Good day, everybody. Welcome. My name is Rolando, and this is Dental Voice. We're excited to be here at Smilecon 2022, and what we're going to be talking to you all about is dentistry, right? But more important than dentistry, what we're trying to do is understand what's next in dentistry. So many things have been happening, so much is going on. Probably the biggest issue that we've been hearing about is the business of dentistry. So I've got two guests over here who are going to be participating in this. First one, Dr. Marc Liechtung. Dr. Marc Liechtung has about 400 years of experience in dentistry.
89,000 years. I'm preserved.
Yeah.
Just like Roe.
So he used to practice in New York and invented a product called the Snap-on Smile. That's when I met him. He's also been instrumental in building over 20 different practices and selling them. The role that he plays right now at a company called Guardian Dental Partners is that he actually looks at practices and tries to buy them. And what we're going to find out is what does he look for with regard to that. Our other guest over here is Amber Auger. Amber Auger is an incredible person. Met her a while ago. She is a registered dental hygienist, an entrepreneur, has her own podcast, is a consultant, and works with Endeavor Business Media. Mm-hmm. So she's exceptional. Probably has forgotten more about the business of dental hygiene and dentistry than I'm ever going to have. So here's where we're going to start. When you look at what's happening in dentistry, it's evolving. And the only thing that we can say definitively is that dentistry is changing. There are so many different connections, there are so many components, different pieces of dentistry right now that have to integrate into each other. And the issue that we're facing is this. We just got out of one of the most traumatic events in dentistry, right? The pandemic. We're not going to talk about that because guess what? Everybody talks about that. What we're going to talk about is now that we're through that, what's next? And the context of what's next is how or what do young dentists coming out of dental school, young dentists who are working in dental practices, what do young dental hygienists and dental professionals need to understand in order to thrive in a dental practice? Too often, the thing that we hear is that dental professionals don't fully understand business. Well, I want to add a context to this don't fully understand business thing and say it's not about not understanding business. It's not understanding, basically, the business of dentistry. So the first question is, I'm going to ask Dr. Marc Liechtung, what on earth is the difference between business and the business of dentistry when it comes to dental practices?
Right. Great question. First of all, I want to thank Rolando. I would not be here traveling from New York for just anybody.
Can you tell he's from New York?
I often say I'm sorry, but if you need translation, let me know. And I also want to recognize some real pillars in our field, the Hirsch's here, that have been instrumental in creating such great products in dentistry.
Okay.
I'm not saying company name, I'm not doing that, but I have to personally, one of the greatest, I practiced many years, I developed a product, I sold a number of offices, recently I sold a group, and I'm part of a group, but when I walk in the lobby and I can meet Gordon Christensen or see the Hirsch's who have developed products for the industry, it's, you got to throw the shade, throw the accolades to these people because they've done so much for us and for the young dentists that are coming out. Rolando, you've done nothing. You've done nothing.
That is true.
I'm just saying, you're here.
Can you tell he's from New York, right?
Yeah.
Right? Okay.
Mess with me.
So wait.
But let's talk about the business and the business of dentistry because it's one of my passions. So somebody walks in and they look at a store. The store is grossing $200,000.
You're supposed to stay close to the microphone.
The store is grossing $200,000. It's costing them $100,000. They make $100,000. That's business. I'm a young doctor. I come out. I see a practice, but the business of dentistry, the understanding what goes into a practice. A practice is, we hear it all the time, is a living, breathing. It's sort of an organism. It has so many contents to it. You've got a number of things that the dentist, which we'll get into, has to know what to tackle from the onset, which way to go when you're first stepping out of school. And if I want to build a business and build a practice where today's groups practices are looking at, There's certain things you've got to do that you've learned. Never thought it was important, but it is absolutely what you need to do to build a successful practice.
So understanding business, like going and getting a business degree, is
Right.
one aspect of it. But it sounds like the business of dentistry has some subtleties. Share with us what
Right.
some of those are. And when you're looking at a practice, why they're important.
Yeah. So that's the question that I get asked every day. Every day I look at a practice, whether it be in Houston, Jersey, South Carolina, New York, I am looking at dental offices. And we are purchasing practices at a multiple of its profit. So what is that that's important? Well, a young dentist or any dentist, I meet dentists that don't have a clue of certain things. But you have a hygiene program. That hygiene program is a business unto itself. You have assistants that, if you get too costly, can destroy the profit margin of a doctor. You have ordering. Supplies should be with a percentage of 5%. You're ordering supplies at 12 to 15%, and then you're wondering why you're not making more.
So wait, hold on. So the business of dentistry sounds like it's dimensional. In other words, you mentioned hygiene, you mentioned your dental assistants, you mentioned all of the different other aspects in the practice. Are you saying that there is a business context for each one of those?
Absolutely.
What share?
There's
Keep
even
going,
a
come on.
business context for the quality of work that we do out of our chairs, right?
So
Right, Amber? I mean, if you do some bad work and you're redoing treatment, that takes away from chair time, impression time, assistant time, bring back time, take off the temp, redo. You must be proficient in your craft before you could be an efficient clinician building a business.
So just graduating from dental school, people are incredibly clinically savvy. And they've maybe taken a couple of business courses. It's more than that, it sounds like it.
Correct. First of all, there's a show I mentioned to Amber a minute ago that's on Hulu, and I'm not going to. I get no financial reward. But
Are you sure?
I wish I did. But in that, the chef is under tremendous pressure. So
Okay.
every aspect of a doctor's day, how he handles or she handles the stress of the crown not fitting, of the staff member or the team member coming in late. This is called discipline. You can't lose your control. Business people that are focused know that it is a time destruction when somebody comes in late, when my impression didn't work, the patient's not getting numb, but we need to be calm. We need to make sure that we don't lose teammates or team members because we lose our cool. Because
big.
there are options today.
It's so big.
Very, very much more than any time, I should say, that I've been in this industry for the last 30 years, has hygienists in particular know that they are valued more than ever.
Well, hold
So-
on. Are they valued more than ever? I
Depends
keep
on the
hearing-
practice.
Depends on the practice.
I keep
She's
hearing
right.
that there's a chasm, and it's a pretty
So,
big chasm.
I think we're going to dive into hygiene pretty good with Amber here, and we're so lucky to have her, and it's great, and I mean that. But before we get into that, I do want to say, I think young dentists, as you said, coming out, have great advantages today. I do want to say something about, you mentioned that the corona. You mentioned up north we had something called, over east, in New York, New Jersey, we had something called Sandy. We had 9/11. What has shown to people in different industries is more so than anything else, dentistry is resilient.
yeah.
And
I
when
can
you're
agree with
coming as a young clinician out of dental school, going into a resilient profession that has withstood floods, attacks, and epidemics,
Yeah.
we are a very desirable business. And I am more proud than ever to be part of it. Dentistry has done phenomenal things for me and my family. I think there's a lot in this room that it has, and we're all blessed. But young dentists coming out look for digital, look to understand the business. I find people need to understand there's more than just, as you say, numbers, profit and loss. There's the appealing to getting a relationship with a patient, because that relationship is going to go out and tell 3 friends that this doctor is wonderful. So you have to learn how to skillfully move the practice along by still connecting with the patient.
That's a good point.
Right? You have to do all the things we've talked about. Greet your staff in the morning. Don't treat them like they're not with you. Good morning, Mary. How are you? It takes 10 seconds, and it goes a long way. So I think the business of dentistry is both psychological and financial. It's not just one or the other.
That's
and
a
it's
good point.
both. And the most successful doctors that I've visited, and we'll talk about the programs they have a phenomenal team, great procedures, and they run their practice. They know, if I ask them, what'd you spend on marketing last month? They'll tell me $7,200. It was a little low. Usually we do this or that. Sorry. And
I gotta help him do that.
Yeah, sorry, it's heavy. But and that is, it is really important to understand that there are so many components that I tell young dentists, be prepared to be your own CEO. You're running your own company. It may not be 100 employees. It may be 12. It may be 6. It may be 4. But it's your company.
Yeah.
So get a grip.
So, first of all, I love that idea. Be the CEO of your company.
Absolutely.
Get a grip. The business of dentistry is beyond just profit and loss. Help me understand profit and as it relates to a dental practice. And then also how, you mentioned this, hygiene, your dental assistants, and the other aspects of the practice are factored into that, and why you would either look at a practice and say, this is a good practice, and look at a practice and share some numbers if you can, but no names.
Absolutely. Yep.
To protect the innocent.
I am signed, but so I can really protect me.
Right.
But I will tell you, it's a great conversation. It's a great question. I'm going to go through it like this. 20 years ago, we were buying practices at a percentage of gross revenue. A doctor walked in, wanted to sell their practice. They had $1 million practice, and look at the difference on $1 million, what it was. Doctor worked hard, had $1 million practice, took home $500,000, making a very nice living. Guy comes in, wants to buy my practice. How much? $675, $725. About 70% of my gross revenue was sold from that practice. I could buy $1 million practice for 60, 70%. If it's really nicely done, maybe I'll give them 80%. Today is a different world. So today it's about a word called EBITDA. EBITDA is going around our country like it's a positive plague. And I will tell you what EBITDA is earnings before interest, depreciation, taxation, amortization. What that is bottom line profit. Whatever you pull out that's not a reoccurring expense, and the profit after the doctor took his or her compensation is the multiple. Now a practice has $300,000 of EBITDA.
And that's the valuation.
What does that practice get sold for? $1.8 million or $2.2 million today. Why? Because they have control of their expenses. Their hygiene is 30% of their revenue because they are kicking butt in the hygiene room, arresting, probing for scaling, root planing, identifying, scanning with any, I'm not going to use names, but any system, whatever you're using to scan, and showing the patients the treatment. So when the doctor walks in, you have scaling, probing depths. You have probing depths right on the screen, explaining to the patient. You show the discrepancy of the gingival margin. It's easy to talk treatment. That is where technology, quality staff or team members increase your case acceptance. So it is all that has to be talked about, met, discussed, have systems where the hygienist knows what to write on the bracket table or hold or hand off to the doctor. I think Amber will agree, but that is actually what generates a practice doing $1 million to the practice doing $2.2 million when the new doctor takes over.
So you shared with me that it sounds like the tip of the spear in any practice is hygiene. How come I don't get the sense that people realize that?
So if you do the numbers in business, if you take that $1 million practice and the doctor is producing $700,000, or let's say $800,000, and you take off owner compensation. So it's a 35% formula of what the owner is producing. You take 50% as overhead, it's $500,000, and now you take off another $270,000, $300,000. His EBITDA went below 200 because he's doing she's doing all the work. Now you take another practice. Doctor's doing 556, and the hygiene has 3 hygienists that are just doing 40% of the business. That practice is worth exponentially more because they have a $300,000-$400,000 EBITDA because it's not all on the doctor.
Right.
So when the hygiene program is strong, not to mention my statement and that we are the only business I know of that recalls our customers.
Right.
So what other thing, I tell this to my offices all the time, a strong hygiene program leads to many months of very productive dentistry. A strong doctor's schedule leads to another good 2 weeks of inserts. So I am very concerned when I look at a practice and I'm evaluating the practice and I see an empty hygiene schedule but a packed doctor schedule. It's not something we really take very seriously. It's a practice that we are pro-hygiene, we are pro-team. So if the doctors has associates producing a lot and hygiene is strong, their profit, their EBITDA will be much higher, and thus their multiple and their earn will be much greater.
So hold on. So Amber, I'm sitting here watching you.
My head
Your
hurts from nodding.
eyes are lighting up here. You're sitting there.
She's like the dog on the back of a, in New York we have those cars that has this little bobblehead.
I was bobbling.
Yeah.
I was.
So
I don't bobble
Yes,
often.
yes.
So comment on that. What are your thoughts on that?
1,000% accurate information. The other thing that my takeaway is just as much as the respect of the team. If your team doesn't respect you and your quality dentistry is terrible, we're not going to stay as hygienists. We're going to slowly lose that drive. And if we're also not held accountable to what the office standards are, honestly, hygienists are going to slack off because they're making the same amount and they're producing whatever they want, right? If they don't have a goal. For me, I average 3K a day all day long, and I have a blast. And my focus is never about how much I produce. It's about what evidence of disease is in my patient during that day. I'm salivary testing. I'm using a laser. I'm, really maximizing the schedule. There's been times where I outproduce an associate. And I'm
Awesome.
having a blast with those patients. I'm getting hugs. I'm getting Christmas gifts. I'm changing lives, and that's why I'm a hygienist.
I want to caddy up on that. I want to say something. The other day, a practice came across in Georgetown, in Washington. I have the luxury of seeing practice all over, right? And the practice was very, very positive on himself. When we were talking, he said, we're very upscale. I said, that's great. I said, how long does your hygienist get it for each patient? He says, a half hour.
Oh, God.
So when we got off the phone, we
Immediately
had a
have a hive.
discussion, and they said, Doc, what do you think? I said, pass. I said, you can't be a consider high-end dentist and give your patients a half hour with a hygienist.
Right.
There is no way we want that. I bet you his half-hour crowns are really good, too. So my opinion would be, and great no names, right? But my opinion is that what we believe from the beginning of our education would create a profitable, quality-oriented, fun practice is there's no cutting corners. Mm-hmm. You can't do an open margin crown because it's coming back to haunt you. You can't not diagnose periodontal disease because it's going to go up the block in New York. I tell all my practices, anywhere I go, I say, remember one thing. You put a temp, make a diagnosis, give them a treatment plan. They're walking up the block, getting a second opinion, and they're going to say, do you know you have gum disease?
Right.
They're never coming back.
And it's because it's a function of what you are trying to do as opposed to what you're doing for your patient.
And that's the ultimate. I can be involved in a great group, and I'm not going to say the name yet, but it is a great group because we believe in 3 ways you can kill a deal. Legally, by the lawyers, financially, where the numbers just don't make sense, and clinically. If we're evaluating a practice and they have really not great quality or diagnoses, we will walk away. I will walk away.
Oh my goodness. Wow. Okay. I'm going to pull it back.
I love when he gets like this.
I know.
Business of dentistry.
You made him
I love
speechless.
it. We're here for this.
This
Wow.
is so cool. Oh my
It
God.
only took 21 minutes for him to get all excited. I love that. Last time it was a little longer.
So you shared with me that when you acquire a practice, the first thing you do is you go into hygiene and you figure out what quality, make sure that they're good, pay them what they're worth. Then
Correct.
you go to your team and you say, hey, what is it that you've always wanted that the prior doctor never got you? And then you go through the office And then you say anything that looks like it's from 1970, you kind of take away, the beat up chairs in the waiting rooms,
100%.
all that type of stuff, and then you redo everything. Why? And what can dentists who are coming out learn from that?
I got to tell you, it's a great question, and I've been meeting some really amazing young dentists, smart, ambitious, right? And they have the touch that we never did, the computer, the digital world. But there is no substitute for having a practice that has, a team led by a hygienist and a front desk and a treatment coordinator. That, look, one thing we say at Guardian is that we are not in the rehabilitation stage. We look for practices with great hygiene, great teammates, and we build from that. Doctors that want to stay. If, to Amber's point, and I think it's a great one not to be overlooked, if you were talking to the team and they love their doctor, it is awesome.
Yep.
It is awesome because you think I've spoken to this man a little bit. I actually came for therapy. This is just right. He's a therapist. He
is.
Oh boy!
I just got off the couch. But I got to tell you, it's essential that the team. We don't want to get into a practice and then they're saying, she's terrible. She's this. She's that. I wouldn't touch it. We are looking for that. And thank God we have opportunities out there where dentists are really understanding the whole gamut of what runs a successful business in dentistry. You can't, I remember a little story. I remember that I was looking at a practice in Westchester, New York, and I saw the guy was grossing $620,000. I looked at the payroll run, and his front desk manager was making $125,000. 21% of his gross revenue.
Did he know that?
I don't think he knew that, but I did ask him a question on the relationship. And I had to. I'm sorry. I had to. I'm going to keep it clean. I just closed the door and I said, Paul, he goes, 21% of my revenue? And then I told him. So I ended up buying the practice because I had to switch out the manager. But I must say, doctors lose control. His answer to me was, I give her a raise every year. Why wouldn't Amber makes $3,000 an hour because she's bonused, and she's given that and produces that. And
$3K a day, not an hour, but yes.
Well, I'm looking
3K
for
a
an
day.
hour.
Oh, okay.
Wow.
You got to, get those skills going. But no, I mean, it's amazing because she has patients that are Google-eyed. They trust her. And we have to get to that level. Young dentists coming out that think they're going to do this just without the education, without the continuing ed, without the ability, they're going to lose sight of what the end goal is. And the end goal is to build a quality machine that is bringing in 50, 60 new patients a month and treating them like they're the only one in the whole month. And that takes talent. And that takes what we strive for. And that's why it's called a practice.
Mm-hmm.
I love that.
So I have 2 points that I just want to piggyback
Please.
off of you. Number one, if a doctor were to come in a business practice, a business owner were to come in and to say, techniques do you need? What technology do you need? Let me transform the practice. Immediately, I'm sold. Immediately, I'm saying he gets it. It's not somebody who's just going to be okay with this ripped chair. It's terrible. I'm embarrassed to sit my patient in this chair. And this
Right.
person gets it. And then to come to me and say, hey, what do you need to be successful? I'm immediately like, this is a peer-to-peer partnership. I know I can trust this person. I know we can collaborate. We can build a phenomenal practice together because they have my back. The second thing is, I have an amazing dentist that I work with who lets me be me. I am a high caliber hygienist and I don't take any fluff. I'm from New England. I know my stuff. And
It's
I
called
have
crap.
I have a dentist
No,
that's
I
like,
couldn't say that.
you're totally in charge of your room. You're in charge of the hygiene protocol. Help me get better. And I say to them, you're totally in charge of restorative dentistry. So you teach me what I can look for and what your eyes are seeing in this, and I can be your partner. So that's the real thing that I think you're speaking to, which is so hard to find. Hard to
I gotta
find.
tell you, there's so many components, but the major component to me is you look for a very happy team, a team that's loyal, a team that's retentive, because it's all about retention.
Mm-hmm.
Because in today's world, what has transpired with the corona and all the things that people don't want to go back to the offices, and those that we have, yes, hygienists went through the roof in pay, but they can do through the roof treatment. They just have to be exposed. You have to give them that right to own the room. But if you see a beautifully done, technologically advanced, quality practice, I'll bet you that those team members were there for many, many years. Because where would they go? They've got the best stuff, the best doctor, they believe in him or her, and then they have technology. So there's really no reason to leave.
Right.
So, first of all, I'm loving the dialogue, and this is incredible. Young doctors are saddled with so much debt.
Right.
They're saddled with, and they're looking at the prospect of taking all of this, taking loans out and all that type of stuff. So they start cutting corners, and they figure, I can do this myself. Or, you know what? She is better, but look, I don't have to pay her or him as much. What do you say to that?
Anybody here play golf? You take a bad swing out to inside, your ball is going right over the fence and slicing it. You cut a corner in dentistry, it will come back to bite you on the afternoon, early evening when you have to be at a show or your son's baseball game or your daughter's recital or your daughter's baseball game, because dentistry is really unforgiving in my opinion.
So
you put in cut corner work, you're going to get cut corner results, sensitivity, bone loss, bleeding gums. Agreed?
100%.
Right. So I think what with young dentists with saddled with debt, man, there was never a better opportunity for young dentists who are coming out of school now. If you ask me, and I have a son, my youngest son is a freshman in dental school, and I'm excited for him. Because I see his face light up when he learns something new. But young dentists that are coming out and they're entering the work world, they have so many opportunities to join a group or go into private practice with a mentor. But there's pros and cons to everything. It is my opinion that the groups are. I want to just speak for this because groups used to look at dots on the map. Mm-hmm. You know, there's a practice here, there's a practice here. We're going to buy this, and this. What's the revenue? I don't care. Let's just buy the practice. Let's have 30 offices in Austin, 20 in Michigan, 15 in Houston, 30 in New York, and that's it. Didn't matter that they were not profitable. Today, the people that are buying practices and they did not value the dentist or the team. If the dentist was 60 or 55, wanting 35% of production, they'll bring a kid in from 2 years out and pay him 25, 28, 30% and save that. They wouldn't produce half the amount. The quality wasn't the same. And 3 months later, the corporate entity is scratching their head saying, we got to fire the CEO. Today, dentists are valued. We don't buy a practice unless we offer partnership to the doctor. So you're getting a bigger pay at close, and you have a rollover of equity into your practice for the next generation of hits.
So
young dentists can capitalize on those things by being in groups that teach them up.
So it's not just groups, and I want to be balanced here.
Yes.
It's existing practices, it's private practices.
Correct.
But the key, if I hear it correctly, is this: it's not just about how technically or clinically skilled you are. It's about understanding that there are different parameters to that business, and each one of those parameters requires attention. Each one of those requires investment, and they have to trust that, I think I work with Jim, and he shared a comment to me. What's his definition of leadership? Hire the right people and do everything you can to get the hell out of the way.
We always say right people in the right seats, and that is the key. You have a treatment coordinator who can't close a case. You need to move her seat. You have a doctor that's asked to do root canals but can't. You need to get that young doctor taught or referred, because you can't ask people to do things they're uncomfortable with. I can't ask somebody who's never been a treatment coordinator or a treatment or a front desk manager to do those things. It's the right people in the right seats. What I mean about groups, and it's not just groups, is the fear that a young doctor goes into a very reputable private practice is that
Not even a young doctor, right?
5 years out, 10 years out,
Yeah.
but it's different because the older doc will take everything that they want to do. I like the dichotomy. Learn from a mentor, but then learn volume. learn more, not volume, low-end volume, but more of a row that you're going to get a book of business, you're going to have a schedule, you're going to see patients, so you get comfortable with the mouth. While you're doing that, you're getting certain things covered for you. But the private practice mentorship, I'm all about mentorship. Young doctors either need it coming out of school or they've got to find somebody that they could get mentored by.
I love that. They got to find somebody
somebody
can
they're
get
comfortable
mentored
with.
by.
Hygienists would,
Wait.
would gravitate to Amber, and
Wait. Can a dentist be mentored by someone like Amber?
I think a hygiene doctor combination where the hygienist is telling. I do find it more, a female would gravitate more to you and be more comfortable in the dental field and dental room. They will ask you your opinion more. And I never worked with Amber, I would imagine, because I have
They just
I
met
have an
today,
Amber
by the way.
in a couple
We
of
just
the
met.
offices.
Yeah,
Right,
they
we
literally just met.
So, I'm going to leave it like that. But, I don't know how I'm leaving it, but I'm leaving it. But I am saying that, I have a super, super high-powered, productive hygienist that helps the doctors, to your point out things that a young doctor may miss.
Mm-hmm.
But I want to point something else out. A hygienist like Amber, and I'll use the word Cassie, who's my hygienist, also brings me things that the young doctor needs tutelage on.
Right.
So it's not
point.
only about beating up the young doctor, it's bringing me, Doc, I just want you to know this PAP on number 29, it's there. I think they thought it was a mental foramen, but it's swollen. We could bring the doctor in, close the door, go through the process, go through the x-rays, talk up. They don't have to know where I got it from. I was auditing the x-rays. And now we have another set of eyes helping me. So I really can't express, and I know it's music to yours, but I don't know a practice I've ever owned that didn't even have 1, 2, or 3 hygienists. We are always looking to increase hygiene. But more importantly, we're always looking to increase the ability to reduce our costs. And from reducing costs, and I'm going to throw some things at you because you're mentioning young doctors, today's world of digital.
Yeah, what about that?
Yeah, I know you're going to get into that, right?
No,
You like
let's get to
digital.
it now. Yeah.
Let's do it.
And technology, digital
So,
technology.
I was talking to somebody years ago. I don't think you were, but I was, in the world of no digital x-rays.
I practiced dental hygiene with no digital x-rays.
Wow,
Yep.
you're a lot
We had to
older than
learn
you
it.
look.
We had to learn. Yeah.
You
I'm
are
34.
a lot.
It's the night cream. Yeah.
Wow. I thought
Yeah.
you were 26.
No, thanks.
But I must tell you, years ago with digital x-rays, we were dipping, and it was a fortune. A fortune. Solution, stain on your clothes, people on their hands, buying x-rays. Not, hopefully we get them right, then you got to take it again, and that's cost. Then digital x-rays came, and it reduced the cost of x-rays tremendously to a point where every marketing technique we had, we would take a Panorex for free.
Wow.
Because it didn't cost us anything.
Right.
So why do I have to sit on a mountain like I have my nose disjointed, take the pan, see the disease, speak to the patient about cancer, about the angle of the mandible?
Join our inaugural
God.
Olympics at the front of the
I knew I'd
hall.
meet God one day.
Now.
But I got to tell you that today, digital impressions. So I'm going to tell you the difference. Looking at a practice as P&L from a standpoint of taking impressions or supplies. Lab work and supplies will reduce by more than 6 to 8% with digital impressions in digital dentistry. Scanning, sending the file to the lab, having the lab delivering it, it reduces, you could see as much as 10 to 15% for a practice with taking normal standard impressions. When I see a practice, a prosthodontic practices that I see in the city and in other states that are fully digital, 1 to 2%. It's crazy. So when you come, again, positioning your world, if you're grossing a certain number and now it's no longer 15%, but literally 14 or 13% of your gross revenue goes in your pocket. Mm-hmm. Literally goes from the drawer to your pocket. It's amazing. So digital dentistry and the scanning to show practices what they would look like if they did the 8 veneers, if they did the implants in the front, if they didn't have the hooks from partials. These things are exciting. And let's face it, the young dentists today have such an advantage because although they had a tough year or two with clinic, they have an advantage that they're coming out of school and there's so many ways to get educated and so many things for them to learn that it's really a CEO. It's really a business that they're looking at, and now you know the end result. The end result is if I run a really good business, I'm going to get paid a lot of money.
When they let it go.
When they let it
Share-
go.
Hey, share with us some statistics. Share
Yep.
with us some statistics, good, bad, and ugly.
Right. So I would say good because Amber's here. If I see a hygiene program that's 10 to 20%, 10 to 15% of the practice, there is a big problem with that hygiene program. If I see it 30%, 28 to 35%, strong. Strong like bull. $500,000 on $1.5 million practice. I got to tell you, we had a $2.5 million practice, great hygiene program, phenomenal doctor, 1.3 in EBITDA. We paid him $9 million.
Dang.
One dentist stays on for 5 years. He's 48. He banked $7.5 million, and he rolled forward $1.5 million because he ran a beautiful practice. Hygiene was 34%. Him and his associate were the rest. They were ready to grow. He kept his costs down with all digital, digital dentistry. Supplies, rent. Let's talk about rent because rent is a major. I look at people in my town and towns around the country. I mean, you could go to some places. A guy is doing about $75,000 a month. His rent is $25,000. I mean, I know the ego that we get into that we want to be corner store like a Lululemon.
It's a great
What's
example.
Like a Lululemon.
Great example.
And you go in and you have just made a lemon because you are owing more after staff. You are zero EBITDA because you wanted that space. And I know it from looking at it and seeing it and telling the doc, I'm sorry. You're in it for another 12 years. We don't want that lease.
How often does that happen?
And more often than not. But I can tell you some of the kings that I've been through that have big leases have huge practices. And some people think they're growing into the practice. 10, 15, 20 years in, I'm going to grow into this lease. Stop redoing the lease. But more importantly, if you have that under control and your lease is between 5 and 10, 5 and 8%, 7% is probably the sweet spot for a practice to pay in rent, 5 to 8% for supplies. You know, a lot of the groups come in, I know we do, and we lower your cost because we have a 25 to 30% discount. Regular doctors need to find the happy sauce to find these supplies where it doesn't cost them more than 7 to 8 to 10%,
Right.
or else it could get out of hand. So I do have to say I met a doctor here in Houston this morning for breakfast, and I've asked him a couple of questions, and he
Yeah,
he
what were
does.
those- what were those
I
questions?
said, what do you pay your manager? And he said, I know it's over 60. Okay, that's an answer. Hygienist? I don't know. I know we gave her a raise. And last month I said supplies, and I said, what do you normally charge for supplies or get charged for supplies? I don't know. Usually it's not this high, but last month the girls charged $23,000. This is a guy that takes in about $75,000, $80,000 a month. So $23,000 on supplies, $10,000 on rent, and he doesn't know what the staff cost him. And he's wondering, what do you think my EBITDA is? It was zero.
Wow.
So I have to pass on that. But I must tell you, it's a shame. He's an older doc, and these older docs are going to work until they can't. And then they're going to go and close their office and sell the equipment instead of recapturing the practice.
The value.
Getting in a manager, a hygienist that could get control of these things. And that's the important part.
Wow.
Yeah.
Holy cow. So, first of all, I really, really appreciate sharing the context around that. Metrics are key.
Very.
Metrics are always key. The other thing that I really appreciate, and it's giving insight and actual real life examples of what's going on there. I have to ask, and this is a question to both of you, and it's an important one. How do you create and build a good team? Because young dentists have grown up in a completely different world, right? And if you look at the level of interaction that they have, if you look at the way they're everything is digital, so there isn't as much what I'm going to call real or it is all real, but face-to-face interaction. So how do you build a powerful, high-performing team?
I'm going first because I just got the nod.
Okay, you get the.
I gave her the nod.
You notice that was the New York nod.
Was
you
it
know?
the nod to get out or the
Here,
nod
hold
to
on.
go ahead?
I mean, no,
It's a very
either
similar
way,
nod.
either
It's
way,
a,
yeah.
it's a very similar nod.
Step outside or go ahead.
So
Go ahead.
Well, I will say it all starts with the culture of the practice. So I was super fortunate to work with 2 dentists as a new grad. I worked 6 days a week. I worked in 3 different practices. One of the practices I worked in, there's 5 different doctors. All of them wanted something different. One of them, his name is Dr. Magalis. I'm congenitally missing my lateral incisors. So he bonded, these are canines bonded as incisors.
Oh wow.
He's
Amber
like, "Yeah, I
will share her
noticed it. I
X-rays
noticed it.
after
I'll
the.
share my X-rays." Anywho, he came in one day and said to me, "Tell me about the biological width of this patient." And I was like, "I have no idea what that is as a new grad." And he's like, "Sounds like you've got homework." And I drove home and cried and was like, "I can't believe this. I worked so hard to become a dental hygienist. Like, I literally have a bachelor's in hygiene. Why am I getting homework?" And that doctor literally changed my life because I think about, he literally was there to mentor me. Another doctor in that practice, once a week we would have lunch together and review cases. So I learned about vertical dimension. I learned all of these things that I never had learned in hygiene school. So I was able to literally understand the 5 doctors, what they wanted, what their eyes were focused on. Was it they were really more focused on perio? Was it more of the cosmetics? What were they passionate about? And I was able to do that in a way that was never cruel, was never judgmental. If I did something wrong, I was never corrected in front of the patient. And I was always corrected in a way of like, "You did this really well, but moving forward, let's work on this together." And I could talk to the dentist like they were a peer. And I've always carried that with me through each and every practice.
So they
I've
were
worked in.
cruel in a very
teach.
kind way.
And
Cruel
she
to
trusted
teach.
them.
But I also was very sensitive because I came off a really intense hygiene, program. And I was a new grad and I wanted to do everything right. And I felt like I was either right or wrong. And they taught me, no, you're here to learn. And this is your career. You have to take ownership of it. They would treat me to the CE. I had a friend in them. They would ask me how I was in the morning with eye contact and really care.
What you're really saying, Amber, is they respected you.
They did.
And I think there's 3 components to it. First of all, it's a given that we have to hire. We have to have a process to hire. You can't just look at somebody and feel
they're cool. Yeah.
They're cool. They're going to be good. I like their shoes. That will not make a quality team. I think you have to be so respectful, which is Amber's description. It's respect. But let's go with this mantra that we live with. Teamwork makes the dream work. So team is really important. I feel there are 2 components, respect and always give somebody the opportunity to advance. They have to know
Right,
that if I'm a
right.
really great, forget money. If I'm a great clinician, you're giving me 3 days, I'm going to give you 4, 5. If you're a great manager, I'm going to take you and ask you to run 2 of my offices. Or a great treatment coordinator, we'll move you up to a manager of an office. There has to be something because it's for us. If they do a great job, we're making more. There has to be something for them.
Right,
And
right,
I
right.
think the doctors that say, yeah, I'll give them $5,000 or $3,000 at Christmas, that's not what they're looking for. They're looking for an advancement of explaining
about the
what
money.
the biological width is, not berating her in front of people, but explaining it to them, to the team, explaining it to Amber, taking her to lunch, explaining what we need. I think there's a way. The years of throwing the instruments,
Oh,
of treating teams like you have somebody waiting for them in the on-deck circle, those are over.
Right.
Those are over. You let go of a hygienist, you're going to have a 4 to 6 to 8 week lapse where you're paying an enormous amount for temps. So you're going to wonder why my EBITDA went from this to this.
well, hold on. The dentist can do the hygiene then. What's the big deal?
It's a great move. I think spending 2 hours cleaning teeth rather than 2 hours doing 4 implant crowns and 6 veneers is ridiculous.
So wait. So the dentists that actually do that, that's not a good thing.
Well, last I checked, there's 8 hours in a day. So if you're cleaning teeth for 3 or 4, that means it's 3 or 4 hours. You're not treating patients.
Right.
So you had to, and forget. Let's remove ourselves from hygiene. What about the assistant?
Yeah, what about
that's
dental
not making as much? To me, an assistant job is to hear the treatment plan, and then when we leave the room to go and do an exam at hygiene, that assistant is telling the patient, "I want you to know, Dr. Marc is excellent, and you're in great hands here."
Reassure
To Amber's
'em.
point, if I don't have faith and trust in the doctor, and I'm an assistant, I'm walking out and looking at that as I'm going to take a smoke, take a sip of my coffee or eat another muffin. And that's what we need in life. But I am saying that those assistants that care, that are trained well, and have
understand
procedures and processes in place, right people, right places. These assistants are there to help the practice move. And some people talk about a group or a family or practice bonus if they hit goals. Now, I personally never did that until I learned down the road this concept, where I would give the hygienist a little bonus or the treatment plan, but it's the assistants if they do their job. It's the front desk girl lady who answers the phone and says, "Hello, Manhattan Dental Arts, how can I, Amanda speaking, how can I help you?" And it's that first contact. So it is really like an organism. Mm-hmm. It's the mouth, it's the tail, it's the body, and then the result is we call our patients, and we have a vibrant, thriving practice because from the start to the finish, they're treated well, and they're delivering quality dentistry. You can't grow a great practice without those things.
Oh my goodness. Talk to us about this recall thing. What do you mean recall? I thought patients got to come anyway.
Amazing. Because I think I saw a practice the other day where he was like 12% of his gross revenue was hygiene. And I said, "What is with your hygiene? Could we build it?" He goes, "I don't like hygiene." I said, "Do you understand you're in the only profession that has a customer? Forget patients. A customer that leaves your office after spending $5,000 and telling them, 'We'll see you in 4 months. It's your cleaning.' And they'll say, 'Okay, I'll see you.' In 3 months, they get a call. A week after they're appointed, and you just called back and say, 'Mary, now we're going to do the other side.'" So recalling patients gives us the ability to take care of our patients better, avoid any catastrophes, but also from a business standpoint, that should be 20 to 25% of your day, maybe even 30. I think and I'm going to defer this because I think the perfect hygiene day should include 2 new patients, 2 scaling and root plannings, and 4 recall patients. And then 5, oh, I'm sorry, 8 hours. Because I'll work them for 20 if I could. But do you agree with that
I do.
day?
There needs to be diversity of the day.
Correct.
If I'm producing over 4K, I'm mad. Because that means that my scaling, at a whole day of scaling, a whole day of new patients, it's not fair to the team either. It's exhausting.
See, I like Amber. She is very financially focused, and I always feel that it's a great point. But when you see a hygiene day and I don't see any scaling or root planning, what's the first thing I ask? I ask my assistant if you can bring me in the last 8 patients that hygienist saw, and I want to see her clinical probings. Mm-hmm. Because we have ways, it's so amazing in dentistry, and this is really my next, we have ways of overlooking a practice and really governing the practice by our phones. It's simple. You have to probe teeth. You have to detect decay. Doctors, you have to restore the teeth. And if you put in crowns that look like top hats, we don't want them.
Right.
We don't want them. But I must tell you, I walk into some doctors doing a clinical check, and the dentistry is off the charts great. And those guys just love what they do. They don't have people calling them all hours of the night saying, "I'm in agony from the filling you did." But I really feel that it is an entire game. And I feel that way as a person who's a partner in a group. And I'm saying this because that is the group's mentality. We don't feel that we get disgusting work or people that we don't care about as long as they're low paid. We want the best, we teach up, and we raise the revenue. Now, I want to say something about young dentists before it gets away from us. I believe in something that's very important to me. Can I elaborate a little bit?
No, go for it.
All right, I'm going to lean back because I know somebody's going to tell me my posture is off.
Oh, no, you're fine.
Hold the microphone
My
like
posture's
closer
off?
to your face.
No, you're fine.
Pull it
Can I get
there.
a little
There.
extension?
Yeah, there you
I'm
go.
feeling a little bit after 50 minutes. I feel dentists that coming out of dental school should learn 5 things proficiently.
What are those?
In the Mediterranean world, Middle Eastern world, we call it a hamsa. Anybody ever see those things hanging on someone's neck? It's 5 fingers, beautiful.
Right.
So there's 5 procedures I think dentists coming out should really perfect and really look to perfect. Extraction and bone grafting. Years ago, we never bone grafted. So if you took a bone graft and you took an extraction, I'll do the extraction for $275, but that ridge will shrink It'll be hard to put an implant or even a partial. I don't like partials. I don't do partials, or a bridge, because the defect will grow. So this is something that young dentists, old dentists should explain to patients about an additional $475. I hope that was on camera. That was pretty good. Get that. If this is blocking it, I'll be upset. But I got to tell you the second thing.
What's the second thing?
Is root canal treatment. Young, older, middle, you refer out premolars, anteriors, straight-rooted molars. Why? You have 2 hours free. You have to learn rotary today, and I'll get to my point. Third, cosmetic and restorative dentistry. Today's world, cosmetics is, everybody wants to be a cosmetic dentist, but posteriorly, nobody wants ugly fillings either. So think onlays and inlays, because if you're dropping a box, I believe an onlay or an inlay is your best restoration, and if you think it's too much money, what would you rather have in your mouth? The fourth thing is Invisalign or clear aligners. Today's world, there is no reason why a general dentist is not doing clear aligners. You are literally handheld through these procedures. And the fifth thing is general dentists, in my opinion, should be doing single tooth implants. You have the ability today with guided CAT scans in the office, dentist scans in the office, panorexes. You have all the ability to learn how to surgically place an implant. I am not talking about all on fours. I'm not talking about multiples. I'm talking about somebody who gets trained, knows how to do it, has a mentorship where you have somebody that could be there in case you need somebody's advice. Because years ago, if you remember, I know Amber remembers. Doesn't matter the year. Amber knows. So
I don't know about that.
All right.
Come on now.
But you have to take antibiotics. You have to do a rinse. You have to do a scrub. You have to wash down the jaw before you place the implant. Today, you have an opening at 2 o'clock from a cancellation. Why not, Mary? Why don't we just put the implant in? We've been talking about it. You know what, Doc? Sure. Okay, I'll refer you to the specialist. He'll see you in 3 weeks. Right? So, in my opinion, those 5 things create a super general dentist. And that's what I believe today we should have young dentists strive for, to be a super general dentist. The 6th thing is run your business. Be your CEO. So if you take those 6 things, you're really going to be a practice that is going to, in the end, make that $9 million. It's crazy the numbers we're talking about, but they're here. Yeah. It's here. It's now. I could tell you I haven't seen a practice for $500,000. I won't buy it. It's not worth the legal money. We want big and beautiful practices, things that stand out, things that are trophies, and they're run like that. So I believe today's world, everything I spoke on that Hamsa, everything is vendor taught. Meaning if you use Brasseler, contact your Brasseler rep, they'll teach you for free how to do endosequence rotary. If you use Invisalign or Clear Choice, they'll come in and walk you through your first 10 cases. If you want to do implants, right. Yeah, right. You could go to implant placements on weekends. We give courses to our doctors all the time. If they place 100 implants, we send them to Brazil to start doing lateral windows. And because they're under the tutelage of really great surgeons. But I truly believe today's dentistry, the vendors and the companies around us have really grown in reaching us, whether it be hygiene, cosmetics, implants. You know, you just have to look at them. All the fluff is gone. You know, we treat teeth. You want to put Botox? It's not one of my things that I think a dentist needs to know. You know, it's really just you concentrate on those things and focus on your numbers. That is it. Focus on your numbers. This is your life. This is your family. This is the way the people you're going to spend the next. Do you agree?
Yes.
So
that
first
was
of
too
all,
easy. I want you to elaborate on it.
So I'm loving the message. I'm loving the context around it. Amber, I would love to get your thoughts, your impression. By the way, she just met him literally today, and I'm grateful that.
But we're going to have to figure out some
way to work
merge
together.
here.
Oh, yeah.
We're going to
Watch out. We're
kill
getting
the
over.
country.
Right. Share your thoughts on everything kind of he said with regard to the practice, the business of dentistry, building teams, investing, spending the money. Hygiene is the tip of the spear. thoughts?
Just such a run-on question. I will say that what I find that most
He's the
happens.
host.
What happens with,
He can
oh
run
my,
on.
Oh my God! How many questions?
He
is
can
that?
run on.
17 questions. So what I will say is what I find happens in most practices is we love to find the negative. So whenever we're talking about what to integrate in, we focus on the 30% of time, right? So we're in a huddle. We're talking about what we want to implement. Maybe it's salivary testing, for instance, and we're like, we got to do this. We just saw Amber's presentation. We're in, and it becomes a whole list of 1,000 reasons why we can't do it. Instead of taking a step back and focusing on works what 70% of the time. If you're focusing on building your practice protocol for work 70% of the time, you're communicating, you're building respect with one another, you'll figure out that 30% because your team is in it to win it together. You actually have teamwork. What happens when you have a leader who doesn't lead well is you have this tension in the practice. You have people who are fluffing and buffing on the room next to you, and you're trying to talk about systemic hygiene, and you can't. You can't because what happens is that patient sees, the husband of the person you just saw, you salivary tested, you did the laser, and now the other person down the hall is saying, oh no, everything looks fine, even though that patient is in disease. So there needs to really be accountability for how each provider is calibrated in the office. If there's no teamwork and no calibration, you're not going to be successful.
I love that. I love the sentiment behind it. I love how it dovetails into what Dr. Mark's been talking about, and most importantly, for me, what I'm learning through this entire process is the key is that team, and it's not necessarily something that you can not necessarily you can't ignore it. So we have got about 2 minutes.
Yep.
What I'd love for you, if you could, in a minute or so, is sum up everything that we just
Can't
talked
do
about
much
here.
in a minute or so.
Oh, you can do a lot in a minute.
That's true. We want to tell that, but in a minute or so or two,
I've been the same question.
I've been through the industry, and I'll try to cut it short to give Amber time. I've been through the industry on both sides of the aisle. I created a product. I had a lab. I saw private practice.
Yeah.
I saw group practice many times. Sold many practices. I think dentistry is amazing. I've said it many times. I really think that if we watch the old saying, watch your P's and Q's, always aim for the top. Don't settle for mediocrity on anything you do, because I will end by saying this is not a dress rehearsal. This is one time through. So I get asked, when are you retiring? I said, why do I have to retire? I don't want to retire. It took me 30 years to get to where I am. Now I got to talk about retirement. I love this. And we're blessed to have a profession that we're all here because we love. So it isn't a dress rehearsal, right, Amber? We go at it, we grab it, and there's some people you meet in the industry. The Hirsch is in here. Rolando is, and all kidding aside, he is one of my closest friends in this industry. I only have one or two. And really, I really just met you too. Amber, what do you think?
Thank you.
Thank you. I
Thank
think
you.
one of the biggest things to remember is that we're not against each other. There's a huge division between hygienists and dentists now, and that doesn't have to be the case. It's how you're leading, and if there's something you don't like in your practice, have that conversation. Take leadership courses, figure out what your team needs to be successful, and control it. You're in control of your practice.
Absolutely.
That is outside. So first of all, Dr. Marc Liechtung.
Like tongue.
Liechtung.
He always stresses the tongue. Like tongue. So Ro, I want to say one thing in 6 seconds. Ro was one of my first Snap-on Smile wearers, and he used to look so good.
Hold on. Well, no. Amber Auger. First of all, if people want to contact you, Amber, or want more information, what's the best way to do that, if you would, real quickly?
Yeah, amberauger.com.
AmberAuger.com.
How do you spell it?
AMBERAUGER.
Right. .com.
Yeah.
Dr. Marc Liechtung, if people wanted to get more information from you, what's the best way to reach you?
Leichtung at Gmail, MLIECHTUNG at Gmail, or just give me an email, Marc Liechtung, and come to visit New York. I'll be there.
Thank you so much
to
Wait.
Rolando for doing this. I really appreciate it. It was excellent.
First of all, I really appreciate it. There is an energy. There's a passion that the two of you share. The two of you share because you're from New York, that type of stuff. I'm grateful that you joined us here. This is Dental Voice. Thank you so much. Really appreciate it. Take care, guys. Looking forward.